Welcome. Welcome to the Red Shoes Gala. Welcome families, friends, patrons, as we like to say, champions of change. This year, FASD United is celebrating its 35th anniversary. And thank you. And one way we're celebrating is by growing in all conditions, the theme for this evening. I hope you like the flowers on your table. We are here tonight to recognize the organization, but our community, and also honor a movement built by all of you, by families, self-advocates, researchers, and policymakers. And what you have all done is turned the obstacles and challenges in this field into opportunities. And you're all part of the FASD United story. So we thought, the 35th anniversary, we should tell you that story. So I will now, unabridged, begin with in the beginning. No, we're not going to do that. We have several speakers, so please be patient. But there's a lot to share. And I don't know that many of you know, and in fact, some of the staff may not fully appreciate that the organization was founded when Patty Munter, who established the organization, a contributor to Rolling Stone magazine, had spent time in New Mexico among Pueblos and in South Dakota among the Sioux tribes, but also the general population. And she saw young children, adolescents, with the fetal alcohol syndrome, and which wasn't very well known at the time. And she said, I'm really interested in this, so what I need to do is I need to find out what it is and how do you prevent it. And so she looked up the national organization, and it didn't exist, of course. So she had to do something. And she incorporated in South Dakota the National Organization on Fetal Alcohol Syndrome. Those of you who have been coming for years know, 4 years ago, we evolved into FASD United to embrace all of you who are part of our community. And Patty realized that she couldn't do everything from South Dakota, and she asked her college roommate, Cara Kennedy, Senator Ted Kennedy's daughter, how do we move forward in this? And she said, well, you got to go to Washington. And you know, my dad will host the first fundraiser for the organization at his home. And he did. And the entertainer Carole King was there, and shortly thereafter, Bonnie Raitt, some of you may have heard of, came in and didn't do a full concert, but donated and did a public service announcement, along with Jimmy Smits, who starred in a movie called The Broken Chord, based on the book, The Broken Chord, by Michael Doris. And Michael Doris had been one of the founding members of the organization, along with activists like Cecilia Fire Thunder from South Dakota, and a young senator named Tom Daschle from the state as well. And Daschle did pretty well and became his party's leader, and that helped out the issue, and legislation was passed successfully, and the federal agencies got more involved, not involved as they should be, but more involved, and off we went. This event began over 30 years ago, and I've been to all but that first event. Yes, I know I've been here too long, I'm sure, but we've had luminaries over the years. The main luminaries, of course, are the families and the individuals who live with FASD and care deeply about this issue and have educated myself and the FASD United board and policymakers and on about FASD. But and we honored members, of course, Senator Kennedy, John McCain, Orrin Hatch, Nancy Pelosi, on. They all came out, nearly 50 members. In fact, we stopped doing that because so many members had come out, and from both parties, of course. One year, in fact, the Republican senator from Alaska, Ted Stevens, stood up before it was his time to come up and said, you know, I've got to go back and vote, but I'll be back. And at that moment, Tom Harkin, the Democrat from Iowa, stood up and said, I got to go cancel out his vote, so I'm going with him, but we're both coming back. And they did. They came back, they left together, came back together, and they both stood up and talked about how they support fetal alcohol spectrum disorders, prevention, awareness, education, most importantly, support for individuals who live with FASD. And so that continues today. We were up on Capitol Hill this year with our Hill Day, over 100 people, I don't know how many meetings, crisscrossing the Hill. And fortunately, we find that both parties support the issue. Of course, the leadership of both parties don't want to do everything or anything, maybe sometimes, but we're making progress. We're making progress. So those early days, we've grown considerably, thanks to all of you. The biggest credit, I think, goes to the team, the staff and the board of directors. Jen Wisdaw is here somewhere. There she is over there. And yes. She has assembled a merry band of more than 20 now, which you have paid for. And the board is dedicated, as always. Mike Anderson is here. He is our chair. Yes, thank you. Thank you. Others not able to join us, but Catherine Shea, Michael Hogan, Karen Poteet is here tonight. Where is Karen? There she is. Good to see you. The legendary Kate Boyce Reeder is here. And in fact, we've known each other so long. I mean, the conversations are not always about FASD. Earlier, we were talking with Dr. Tracy Coolmoose, who is running the FASD project in the Department of Defense, and we were talking about our tattoos, which was, you know, for the first time, and the tattoos that our kids have. But the fact is, okay, none of us have one, but if we, and I'm glad we didn't get the original. That's right. We didn't get the original No Fast tattoo, but I don't know, the FASD United circular tattoo. I mean, that's pretty cool, right? I mean, so we'll see. But Jacqueline Cortez Wang is here. Yes, yes. Thank you for being on the board. William Edwards is not with us tonight, but an important part of the board. And Connie Mazelski, the fabulous Connie Mazelski, is here front and center. Thank you. Christy Petrenko, while the doctors are in, Christy is here. Christy Petrenko, yes. And also Dr. Omar Rahman. He's over here. We're happy to see you tonight. Now, they're not new to FASD. They're instrumental in bringing us to where we are with the issue, and we're fortunate to be able to recruit them and have them join the board. So it's always helpful when you have clinicians, researchers, stakeholders who will say, okay, let me get my hand in here and help you raise some money and help you find your way on this issue to make sure we're most efficient and effective with the support we have. Not on the board this term, but Susan Shepard Carlson, of course. I don't know, the conscience of FASD, I don't know. I mean, yes, I mean, such a vital influence in the progress we've made, linked to so much of the work that we do. Founded an organization in Minnesota over 20 years ago, First Lady, of course, of Minnesota, and it's important to know people in high places, and they get things done. They get things done. Beth Bartlett is here. Where is Beth? There she is, just off. You knew I was going to say this, but there's so many meetings. Beth, you know, we're on the Zoom and everything, and she says, "Oh, just a minute, I've got to go deliver a baby." And it's true. It's true. But you know, I see, Jen and I, the team sees the board members, some of you, 4, 5, 6 times a week, because you're also involved, you know, virtually, of course. Also, because, you know, this is what we do. We have the board members. You really got to get in there and be active with the committees, our policy committee, development. And of course, we don't have to pay them, which is nice. We use them as much as we can. But okay, enough of that. We have, I don't know, I think you have in your program, you've maybe seen the list of folks tonight. And boy, we've got a lot of people that are going to be coming up here. So I'm going to do my very best to have people come in, be profound, you know, be a little emotional maybe, and get you thinking about, you know what, I need to double my support for this organization. Look how fabulous they are. So I hope you do.
I am Susan Shepard Carlson, and a little bit about, I don't want to go into a lot of detail, but I began my journey in this issue in 1997 when I was Minnesota's First Lady and also a juvenile court judge. And it was those two positions that got me thinking about the substance abuse in families and the resulting harm to children. And so I began that journey, and And I'm supposed to talk about the decade from 2000 on. And I remember the first time I really got involved with NoFast was I received a leadership award in 1998. And I remember having lunches with Tom Donaldson. And I said, Tom, you know, you're the national organization. You really need to have affiliates. And when Arnie left office, I felt we had done state policy and had got funding in the state of Minnesota. We had done a task force, and I really felt that there had to be a private effort as well. And so we formed Minnesota Organization on Fetal Alcohol Syndrome. And so when I would have those conversations with Tom, I'd say, Minnesota could begin to lead that effort. And so those discussions started back then, and then there was funding that came in the early 2000s that allowed NoFast to begin that effort. So, and I think when people get into this, you never leave this. I think to my dying day, I'm going to be involved with this issue because you see so many possibilities on how it could be different for this population. And we've seen that through the work of all the families in our work with the Respect Act over the last 5 years. I mean, it's been incredible. So it's such a joy to see everyone here tonight celebrating our 35 years of growing in all conditions. And when I hear those words, I think of the strength and resilience of this community. And that is so true. I mean, through all these years, you see some of the same people, but then there's new people that come into this community, and we've grown. And despite challenges, we've had a lot of challenges over the years. Despite barriers, we have created a network of hope. And so, the movement grew into the FASD, United Affiliate Network. And it's a powerful collaborative of organizations across the country, but I'd also say people, and each rooted in their local communities, but deeply connected to each other. And during COVID, we began with our work with the Respect Act, meeting with the Zoom. We would not have been able to connect like we did after COVID. And as one of the original founders, I have had the privilege of watching it grow from a handful of voices to a chorus of advocates, professionals, and families. And just like our theme tonight, the network has grown in all conditions, rural and urban, north and south, in red states and blue. I still remember the early days when the landscape for FASD was quiet and far too often invisible. But we knew that had to change, and change it did. That's why in Minnesota, we planted those first seeds with what is now, it's now called Proof Alliance. And I don't know if we have Kendra from Proof Alliance? And there's, okay. And they have been a remarkable organization. We believed in a simple truth, that people impacted by FASD deserve to be seen, supported, and empowered. And that belief became action, and that action became a movement. And then during that time, the FASD field also flourished with the launching of the SAMHSA's FASD Center for Excellence. And I was a part of all those years with the Center for Excellence. And that brought together people from all over the country every year to discuss strategies and innovative pilot programs such as screening for FASD in various populations. And one of the, when I was a juvenile court judge, we were able to get funding to screen in our juvenile court in Hennepin County, Minnesota. And it was remarkable. What we found, about 25% of the youth that we screened ended up with a diagnosis of FASD, but more importantly, when we educated their caregivers and professionals, probation officers, social workers, in-home family therapists. These youth, their outcomes improved dramatically. So we know what works. And unfortunately, we weren't able to communicate that well enough to the powers that be, and the loss of the center in 2016 was a setback for the FASD movement. But I feel extremely confident that this work will return in the near future, and more. Christy can talk more about that when she talks about the FASD Respect Act. And one of the FASD's enduring initiatives, and that was alluded to by Heather, was the Circle of Hope, which also came into being during the early 2000s by Kathy Mitchell. And that created a network of women with FASD lived experience and substance use, and created a space where their voices were heard and they led the field. And it became a circle of power, transformation, and compassion. So tonight, I look around and I see so many friendly faces, and I see the fruits of years, decades of tireless work, but I also see the seeds of what's to come. And I'm very optimistic. So, whether you're a parent, a professional, an advocate, or someone who simply believes in this cause, thank you. You are part of this garden. You are part of this movement. We have created something extraordinary, but the growth isn't just about numbers, it's about deepening impact. So, if you were part of the Center for Excellence, have participated in the Circle of Hope support group, or a member of the affiliate network, please feel welcome to stand so we can thank you. Everybody. Thank you. Thank you very much. And I thank all of you for being here tonight, because without you, you are a part of our family, and without you, we need you to flourish. So enjoy the rest of your evening.
Just to name the start of the key collaborations was in 2004 when we organized a consensus conference, a terminology summit, collaborating with federal agencies, the CDC, NIAAA, SAMHSA, researchers, clinicians, advocates, and international leaders to forge a consensus on the definition of fetal alcohol spectrum disorders. So we weren't always just talking about FAS, we were talking about the spectrum. In 2005, we collaborated with the U.S. Public Health Service and the Office of the Surgeon General to revise and reissue an advisory to urge abstinence from alcohol during and when planning a pregnancy, and to recommend alcohol screening and brief intervention as part of routine clinical practice. Then the U.S. Surgeon General headlined our 2006 Gala, so that was exciting. In 2008, we created the Native American Youth Program, a collaboration with Cherokee Nation, Mississippi Band of Choctaw Indians, and the Standing Rock Sioux Tribe on an alcohol and pregnancy and FASD peer education initiative, training youth leaders as peer educators who educated adolescents, teens, and young adults about the risks of alcohol and substance use and how to make healthy choices. In 2011, the weekly roundup got launched with collaboration with the FASD field to share FASD news, features, commentary, and resources. The roundup is now the most widely read publication on FASD in the country. In 2012, we saw creation of CFASD, which is the Collaborative Initiative on Fetal Alcohol Spectrum Disorders, wherein FASD United is the only non-research member of the world's leading FASD science consortium. Promoting published research, seeking translation of research to practice, and linking scientists to the lived experience. And in 2022, what I think is one of the most exciting developments is that FASD United worked with Champions on the Hill, and I have to give a lot of credit to Susan Carlson with her relationship with Congresswoman Betty McCollum, whom we've honored several times here. Got some funds appropriated in the Defense Appropriation Bill 2 years in a row, and that set off a collaboration with the Centers for Health Services Research at the Uniformed Services University of Health Sciences on an FASD research project in the military health system, led by Dr. Tracy Kulmus, who is here tonight. We're so delighted. And by the way, the winner of the Panama trip should also speak to Tracy because she had a wonderful trip there. Excuse me. As a key component, we're developing a pilot telehealth consultation model for primary care providers under the direction of Dr. Eric Flake, who is here with us this week but not here tonight. The future goal is to deploy the FASD practice using a hub and spoke model to reach military beneficiaries nationally and expand into the civilian clinical settings. So, if you were part of CFASD, the Terminology Summit, USIS, or other collaborations, please stand so we can recognize you.
Everybody. So I am Christy Petrenko. I'm at the University of Rochester, and I'm so excited to be speaking with you, bringing us up to the current. So it's such a joy to see FASD United reaching that 35-year milestone. And I'm here to talk about one of our most recent and ongoing breakthroughs in the FASD community and field. You may be wondering, why would a researcher be up here talking about policy? Well, it's a fair question. I've spent my career in the lab, in clinics, and working directly with individuals with FASD and their families. And my job has always been to gather data, analyze outcomes, and to understand what helps people thrive. But after more than 2 decades in this field, I've come to a very clear conclusion. Systems don't change because of data alone. Systems change when policy changes. Behind every successful program, every innovative clinic, every statewide initiative that supports people with FASD, you'll find one common thread. Policy provided the funding and structure to make it possible. And that's why I'm here. Because science tells us what works, but policy determines who gets access to it and whether it happens at all. And that's where the FASD Respect Act comes in, and that brings many of us here this week in our work. In 2021, a group of visionary leaders, Judge Susan Shepard Carlson, who you've heard from today, Senator Amy Klobuchar, and Senator Lisa Murkowski, introduced a bill that finally would put FASD on the national agenda. And I'm going to change would to will here in the lovely remarks Emma helped me put together. The FASD Respect Act is more than legislation. It's a blueprint for building the systems we've needed for decades. It will provide dedicated funding for prevention, screening, diagnosis, and lifelong supports. It will build statewide infrastructure and community-based programs that we desperately need. It would create training pipelines for professionals, and most importantly, it will ensure that individuals with FASD and their families are no longer navigating this alone. This kind of change isn't abstract for me. In my research and clinical work, I've seen families wait years for diagnosis. I've been in schools and seen them unequipped to meet the needs of their students. I've seen the emotional cost of being misunderstood, misdiagnosed, and completely invisible in our systems. And I've also seen what happens when the right supports are in place. Kids thrive, adults thrive, families stabilize and feel supported, and communities become more inclusive. But again, it doesn't happen without policy. That's why the community mobilized. From 2021 through today, you have written letters, you've shared your stories, educated lawmakers, including the work today, and built bipartisan support that continues to grow. And while the RESPECT Act hasn't passed yet, we are closer than ever because of you. So if you've participated in our legislative advocacy, whether through a Hill visit, an email, a call, or sharing your story, please stand up so we can thank you. And I think that's going to be a lot of people in this room, which will get you moving after sitting for a while. So everyone, thank you. And if you're not yet standing, I give you a charge that you too can be a part of this. We need everyone in this room, and you all can have a voice. And if you were like me and not sure you could do this, you can, and we are here to help you. So thank you so much for coming tonight, and I'm going to pass the mic. We're almost done with tonight, but we have a couple more important things.
Christy Petrenko, ladies and gentlemen. So you've just heard about the vital role that policy plays in creating systems change, and it's really important. But policy is only as effective as the people and the stories that shape it. That's why I'm here to talk about what needs to happen next. For those of you that don't know me, I am the fiercely proud mama of 3 young adults with FASD. And I stand dedicated to ensuring that lived experience is not just included, but centered in everything we do. FASD United, and really this entire movement, is shifting the paradigm. We're putting people with living experience at the center of policy development, program design, training, and increasingly research. This is key because they are the experts in their own lives. We've seen this during the FASD RESPECT Act. It wasn't just professionals or policymakers advocating. It was parents, siblings, self-advocates, aunties, uncles, grandparents, neighbors, friends, and whole communities who used their voices to educate lawmakers. These stories have moved the needle more than any statistic ever could, and they continue to do so in increasing numbers. We've done over 2,000 legislative visits. And this is collectively as a community. So as we look to the future, we're building a movement where lived experience isn't an afterthought. It's the starting point. We are proud to have people with FASD, as well as siblings and parents of people with FASD, and other disabled people on our staff and on our board. Self-advocates should be and are starting to be involved at every level, and this is just the beginning.
Hi. Thank you, guys. No. I'm here, really, yes, to thank you all for being here, for sponsoring this event. Thank you to our sponsors. Thank you to our repeated sponsors, to our newer sponsors who have sponsored for the second time, which means you're now a returning sponsor. It means so much to us as someone who is a sibling to somebody with FASD, someone who's autistic myself, and still dedicates as much of my time and energy to this cause as I can. I know that this is a research topic. I know that it is something to invest in with sponsorships, and we are all in this room together, hoping for the same things, going for the same goals, and I am grateful for it. I'm grateful for any time nowadays where I can be in a room with 100, almost 200 people, and us be agreeing, hearts all in on something, and I thank you for being a part of that. I want to thank Connie Mazelski for being a terrific co-chair of this event and for being someone who I can share professional and personal things with. And we can share the fact that, yes, we are doing this professionally, but we have family investments, and that means the most to us. I want to thank Kate Boyce, there you are, who came back from a hiatus. Well, you've been on the board so long that it's crazy to say you're ever not on the board, but to return to help with this gala means the world to me as someone who is not a natural event planner. You are. And I want to thank the people in the audience, people with FASD. This is the most people with FASD we've had at our gala, as far as I've been here. That is something to be incredibly proud of, because no matter what we are doing, people with FASD deserve a space in the room, a seat at the table. And I want to thank the caregivers. I want to thank the family members, the friends who came out here on behalf of someone else. It means the world, and we will never forget it that you showed up.